Have you been taking your blood pressure medication every morning exactly as your doctor prescribed? If so, you're doing what millions of adults over 60 faithfully do every single day. But here's something that may surprise you. The time you take your medication and even what you consume alongside it could make a much bigger difference than most people realize. In some cases, it may even influence how well your heart and blood vessels stay protected throughout the day. Welcome to Dr. Andewala, where we simplify complex medical research into practical, easy-to-understand advice that can help you live a healthier life. If you're finding this information helpful, take just a second to support the channel. Click the like button and subscribe to Dr. Andewala. It costs you nothing, but it helps us continue bringing evidence-based health information to millions of people who need it. Today's discussion is based on scientific evidence that has changed the way many experts think about blood pressure management. Yet surprisingly, many patients have never heard about it during a regular doctor's appointment. Researchers followed more than 19,000 people with high blood pressure over several years to study something incredibly simple: the timing of their medication. What they discovered shocked many cardiovascular specialists. Certain medication habits were associated with dramatically better heart protection than others. The difference wasn't small, it was significant enough to make experts reconsider long-standing treatment routines. Today I'm going to walk you through 5 common medication timing mistakes that thousands of people make every single day without realizing it. Some of these mistakes involve coffee, others involve certain fruits, missed doses, or simply taking medication at the wrong time of day. And the number one mistake may already be part of your daily routine. Before we begin, I'd love to know who's watching. Tell me your age in the comments below, and let me know whether your doctor advised you to take your blood pressure medication in the morning or at bedtime. Your experience could help someone else who is watching this video. Now let's start with something your body does every single day without you even noticing. Your blood pressure doesn't remain constant for 24 hours. Instead, it follows an internal biological clock known as the circadian rhythm. During healthy sleep, blood pressure normally falls by around 10 to 20%. Doctors call this the nighttime dip. Then, just before you wake up, your body prepares for the day ahead. Stress hormones begin rising, your nervous system becomes more active, and your blood pressure naturally increases. This early morning increase is known as the morning blood pressure surge, and it's one of the most critical periods for your cardiovascular system. Research has shown that a large proportion of heart attacks and strokes occur during these early morning hours. Unfortunately, as we grow older, our arteries gradually lose flexibility, making them less capable of handling these sudden increases in pressure. That means protecting your body during this window becomes even more important after the age of 60. This is why medication timing matters more than many people think. Your prescription isn't only about lowering blood pressure. It's about making sure your medication is working when your body needs it the most. A pill that reaches its strongest effect at the wrong time of day may not provide the protection you expect. Now let's look at the 5th most common mistake, and it begins with something millions of people enjoy every single morning: a hot cup of coffee. Most people never imagine that their coffee could interfere with blood pressure medication. In many situations, it doesn't. However, if you're taking a beta blocker, timing becomes very important. Medications such as metoprolol, atenolol, and carvedilol work by slowing your heart rate and reducing the force with which your heart pumps blood. Think of them as gently easing your heart's workload. Caffeine, however, does almost the opposite. It stimulates your nervous system, increases adrenaline release, raises your heart rate, and can temporarily increase blood pressure. Imagine pressing the accelerator and the brake pedal in your car at the same time. That's similar to what happens when coffee and certain beta blockers reach peak activity together. Although the medication usually continues to work, some people, especially those with irregular heart rhythms, may notice fluttering sensations or palpitations shortly afterward. Clinical observations have found that patients who drink several cups of coffee immediately after taking certain beta blockers are more likely to experience these uncomfortable symptoms than those who separate the two by at least 45 minutes. One patient I remember had been experiencing a fluttering sensation almost every morning. She believed anxiety was causing it, but after reviewing her routine, we discovered she was taking her medication just minutes before drinking her coffee. We simply adjusted the schedule by taking the medication first and delaying coffee for about 45 minutes. Within a couple of weeks, her morning palpitations disappeared completely. The lesson here is simple. If you're taking a beta blocker, give your medication time to leave the stomach before drinking your first caffeinated beverage. Drinking a full glass of water with your pill also helps maintain consistent absorption. Small timing adjustments like these may seem insignificant, but when repeated every single day for years, they can make a meaningful difference in how consistently your medication performs. Now let's move on to another mistake that's far less obvious but potentially much more dangerous. The next mistake catches many people completely off guard because the effects don't always happen immediately. In fact, you may consume the problem on Tuesday and not experience the consequences until Thursday. I'm talking about grapefruit and grapefruit juice, one of the most overlooked food interactions with blood pressure medication. Many people have heard that grapefruit can interfere with certain medications, but few understand why. Inside your digestive system is an important enzyme that acts like a security checkpoint. Its job is to regulate how much of many medications enter your bloodstream. Grapefruit contains natural compounds that temporarily disable this checkpoint, allowing much higher levels of certain drugs to circulate in your body. The effect isn't short-lived either. A single serving of grapefruit or grapefruit juice can interfere with this enzyme for up to 3 days. That means even if you don't consume grapefruit on the same day as your medication, the interaction may still occur. This becomes especially important for people taking certain calcium channel blockers, including medications like amlodipine, nifedipine, and felodipine. When the body's normal processing system is disrupted, medication levels can become much higher than intended. Instead of gradually lowering blood pressure, the medicine may reduce it too much. The result can be dizziness, lightheadedness, weakness, blurred vision, or even fainting. For older adults, these symptoms are far more serious than they may sound. A sudden drop in blood pressure can lead to dangerous falls, broken bones, or hospitalization. Researchers studying thousands of patients found that individuals who regularly consumed grapefruit products while taking susceptible blood pressure medications experienced significantly more episodes of low blood pressure compared with those who completely avoided grapefruit. I remember one older gentleman who had taken the same blood pressure medication successfully for years. Then his family began buying a new breakfast juice blend that quietly contained grapefruit. Nobody noticed the ingredient listed on the label. Several days later, he stood up after breakfast, became extremely dizzy, and collapsed. Fortunately, he recovered without permanent injury, but the unexpected interaction was the real cause. That's why it's so important not to assume every citrus fruit behaves the same way. Oranges, apples, and many other fruits don't create this particular interaction. Grapefruit is unique because of the compounds it contains. If you're prescribed a calcium channel blocker, don't guess whether grapefruit is safe. Ask your pharmacist or physician specifically whether your exact medication has a grapefruit interaction. It's a simple question that could prevent a very serious problem. Another helpful habit is paying attention to your body's mineral balance. Foods naturally rich in magnesium such as spinach, almonds, beans, and pumpkin seeds help support healthy blood vessel function. While they don't replace medication, they can complement an overall heart-healthy lifestyle. If you've been taking blood pressure medication for years, it's worth asking your doctor whether your magnesium levels should be checked during routine blood work. Now let's move to timing mistake number 3, and this one often disguises itself as something many older adults simply accept as part of aging. Imagine waking up every single night at 1 o'clock, then again at 3, then again just before sunrise. Many people assume that's simply what getting older feels like, but sometimes the real cause isn't age at all. It's medication timing. Diuretics, often called water pills, are among the most commonly prescribed medications for high blood pressure. Drugs such as hydrochlorothiazide, chlorthalidone, and furosemide help your kidneys remove excess fluid from the body. Less fluid inside your blood vessels means lower pressure against artery walls. The problem begins when patients take these medications too late in the day. Some forget their morning dose and take it during dinner. Others were never told that timing actually matters. As the medication reaches peak effectiveness several hours later, the kidneys continue producing urine throughout the night. That means repeated trips to the bathroom while your body is half asleep. Each time you suddenly stand up, your blood pressure briefly drops before your circulation catches up. Doctors call this orthostatic hypotension, and it's extremely common among older adults. Unfortunately, nighttime falls are one of the leading causes of serious injuries after age 70. A simple trip to the bathroom in the dark can quickly become a life-changing accident. Hip fractures, in particular, often require surgery, lengthy rehabilitation, and may permanently reduce a person's independence. Large hospital studies have shown that people taking their diuretics late in the afternoon or evening experience substantially more nighttime falls than patients who take the same medication early in the morning. One retired librarian told me she'd been waking up 3 or 4 times every night for nearly a year. She assumed aging had permanently ruined her sleep. After reviewing her medication schedule, we discovered she had been taking her water pill with dinner because no one had ever explained otherwise. We simply moved the medication to 8 o'clock in the morning. Within days, she was sleeping through the night again. She couldn't believe that one small change had transformed her quality of life after months of frustration. If you're prescribed a once-daily diuretic, the safest habit is usually taking it before 10 o'clock in the morning unless your physician has instructed otherwise. If you're taking 2 doses each day, the second dose is generally best taken no later than early afternoon to reduce nighttime bathroom visits. You can also support your body by eating potassium-rich foods if your doctor says they're appropriate for you. Foods like bananas, oranges, potatoes, tomatoes, and yogurt may help replace potassium that some diuretics gradually reduce. However, never start potassium supplements without medical advice because certain blood pressure medications can actually increase potassium levels instead. The important message is this: medication timing isn't simply about remembering to take your pills. Sometimes it's about protecting your sleep, your balance, your independence, and ultimately your safety. Now let's discuss a mistake nearly every patient has made at least once, and one that can become surprisingly dangerous if handled the wrong way. Almost everyone who takes daily medication has experienced this situation at least once. You look at the clock and suddenly realize you forgot your morning blood pressure pill. Maybe you remember during lunch, maybe after dinner, or perhaps right before bed. Your first instinct is often the same: I'll just take 2 pills tomorrow, or I'll double the dose tonight. It sounds logical, but depending on the medication you're taking, it can be a serious mistake. Blood pressure medications are designed to work at carefully studied doses. Whether it's an ACE inhibitor, an ARB, or a calcium channel blocker, each tablet is meant to lower blood pressure gradually over a specific period. Taking 2 doses together doesn't simply provide twice the benefit. Instead, it can lower blood pressure far more quickly than your body is prepared to handle, especially if you're over 60. Think of your circulatory system as a network of flexible pipes carrying blood to every organ. Your medication gently relaxes those blood vessels, allowing blood to flow more easily. But when you suddenly double the amount of medication, those vessels may relax too much. Blood pressure can fall sharply, reducing blood flow to the brain. That's when dizziness, fainting, blurred vision, or even injuries from sudden falls become real possibilities. Older adults are especially vulnerable because aging naturally reduces the body's ability to respond quickly to sudden blood pressure changes. A younger person may compensate without major symptoms, but someone in their late 60s or 70s may experience a dramatic drop that leads to collapse within minutes. There's another version of this mistake that's much quieter but equally concerning. Some patients are prescribed medication twice a day but eventually begin taking it only once daily because it's easier to remember. Their blood pressure may still appear reasonably controlled during routine clinic visits, but the medication isn't providing the full 24-hour protection it was designed to deliver. This creates a false sense of security. Office blood pressure readings might look acceptable, while important periods during the day or night remain completely unprotected. Over months or years, that inconsistency may increase the risk of heart attack, stroke, or worsening kidney disease without the patient even realizing what's happening. Researchers who followed thousands of patients found that individuals who frequently doubled doses after forgetting their medication experienced significantly more emergency blood pressure problems than those who simply returned to their regular schedule. Likewise, patients who routinely skipped one of their prescribed daily doses had noticeably higher rates of cardiovascular hospitalization. One gentleman came to the clinic after his wife found him unconscious on the kitchen floor. Fortunately, he hadn't suffered a stroke or heart attack. After reviewing his routine, we discovered he had developed a habit of taking 2 evening doses whenever he forgot his morning pill. He believed he was being responsible by catching up. In reality, the double doses were causing dangerous drops in his blood pressure. So what's the safest approach? In most situations, if you remember your missed dose later the same day and your next scheduled dose isn't close, you should take the forgotten medication as soon as you remember. However, if your next scheduled dose is only a few hours away, it's usually safer to skip the missed tablet and continue with your regular schedule. What you should never do is double your medication unless your doctor or pharmacist specifically tells you that's appropriate for your prescription. One of the easiest ways to avoid missed doses altogether is by creating a consistent daily routine. Link your medication to something you never forget, such as brushing your teeth, eating breakfast, or preparing for bed. Setting a phone alarm with the name of your medication instead of a generic reminder can also make a remarkable difference. Studies have shown that pairing medication with an established daily habit dramatically improves long-term consistency. Now we've reached the number one mistake, and this is the one that has generated enormous discussion among heart specialists over the past several years. It's not about coffee. It's not about grapefruit. It's about something much more fundamental: the actual time of day you take your blood pressure medication. For decades, millions of prescriptions simply instructed patients to take their medication once every morning. It became routine, and very few people questioned it. But as researchers learned more about circadian biology and the body's internal clock, they began asking an important question. What if morning isn't actually the best time for everyone? Your blood pressure follows a predictable rhythm. While you're sleeping, it usually falls. Then, in the early hours before waking, hormones like cortisol begin rising, your nervous system becomes more active, and blood pressure starts climbing rapidly. This early morning surge is exactly when the heart and blood vessels experience some of the greatest stress of the entire day. Now think about what happens if you swallow your medication at 7 or 8 in the morning. Most medications need time to be absorbed before reaching their strongest effect. By the time they reach peak levels in your bloodstream, the morning surge may already be passing. Hours later, during the following early morning, when your body again enters that high-risk period, medication levels may already be declining. That's why researchers began studying whether taking certain blood pressure medications at bedtime could provide better protection overnight and during those critical early morning hours. Their findings started one of the biggest conversations in modern hypertension treatment, and the results may surprise you.